Mission and margin is the business of healthcare. Thanks to our sponsor MedChat, providing live chat, bots, and text tools for a modern digital front door. See medchatapp.com.
Dean Browell, Jeff House, thank you so much for joining the business of healthcare today. Message boards have become incredibly influential on how consumers make decisions about healthcare. What does that look like?
Sure, it's interesting actually, because as much as we actually overemphasize, I think, the larger channels, how someone's going to talk to their family about cancer, how they're going to talk about their own treatment, will be very different than how they'll talk to someone else going through the same thing. And so you think about it in a message board context where someone may go and visit and join a community of people who are just like them going through the same things. And that can take different shapes. It can be geographic-based message boards like city data that's just about a particular city and everybody's there talking about everything from where to shop, school systems, everything else. It could be demographic, like the bump or circle of moms, where it's all a particular demographic all gathering together, or again, all the way down to condition specific. But the point is that it is very different than a public message board, a public channel where Facebook, Twitter, and whatnot play, and that's incredible for us from a behavioral standpoint, but people do act differently there than they might act among peers going through the same thing.
And I think that's one of the really intriguing aspects of the research that we've conducted with Dean, is that it's opened our eyes as a marketing team and as an organization that our definition of social was very narrow. We were focused on the Facebook and Twitter and Instagram and YouTube, and yes, that's where we want to place content, but we've conducted 8 studies with Dean, or have 8 either completed or in the works. 3 are market-based studies where we're looking at different markets within the state of Arkansas to understand different behaviors and getting some really different findings that are valuable to us. We've executed some service line-based studies where, just like Dean mentioned, we're studying cardiology or studying neurology to understand how patients, potential patients, families are interacting on non-Facebook, non-Twitter type interactions and engagements. And then we have several studies that we're looking at. They're going to move into life stage studies, like he mentioned, new moms, for an example, and trying to use those both, again, as much as from our world and from my world, a marketing standpoint, letting the organization understand our customers better, so that from a broader organizational standpoint, we can build the operations that match and meet those needs. We can create a better patient engagement experience.
Jeff, you do some really interesting work. Talk a little bit about what you do.
So over the last 2 years, I've had an opportunity to be involved in the transformation of a marketing function with the only pediatric health system serving the children and families of Arkansas. And really, it's been a process of transforming from an old MarCom approach to a MarTech approach. And inherent in that is really establishing a much more robust, diverse, and sustainable technology foundation for us to really be able to execute modern healthcare marketing, not just as we want to execute it, but as consumers and stakeholders want to engage with us.
And how do you know what the consumer wants?
Great question, and it's actually the first question I asked the team when I joined them about 2 years ago was, are we listening? Are we infusing voice of the customer into our work? I think a lot of healthcare marketing historically, and I worked for an organization and did it, it was an outside-out mentality. It's what we want to tell them. And I think one of the really great moves that we have made is bringing that voice of the customer really into every facet of our work. We have significantly expanded our market research, as you would call it, not just in terms of just scale, but into new methods of research like digital ethnography. And they have helped us really, I think, not just perform better as a marketing function, but opening the eyes of the organization to what do people want.
So Dean, you know that I've been a fan of your work for several years. What is digital ethnography?
Sure, so it's at its base, it's listening. And to really tie it back to ethnography, I always like to use Jane Goodall and the gorillas. We don't touch the gorillas though, we want to just observe. And so for us, it's taking seriously what people are saying online, not just in major channels, but in condition-specific message boards, and really understanding that what people will say when they're in a room in a focus group is certainly important. what they're going to say when they leave that focus group, when they go to talk amongst each other, that's equally as important. And it's out there and informing other people that are reading those opinions and really taking that as true behavior that we can study, we can understand, and we could really use to get insights about the consumers themselves.
So what does that look like? What are you doing as a digital ethnographer?
Sure. So we actually use human beings, which
okay.
in itself is actually a novel idea, as opposed to say software or some sort of just Google searches. We use folks with social science backgrounds. So anthropologists, sociologists, psychologists, who take and look at that behavior. So perhaps it's a mom message board, all talking about their impending birth of their child, discussing where they're going, things they're worried about, things they're feeling emotionally and physically, and taking all of that seriously and taking a look at where are they from, how often do they post, who do they trust, who's asking the questions, who's answering them, really delving into that behavior and then drawing out some interesting insights about them.
You're bringing some pretty creative ideas in how to approach marketing and MarTech into your organization. Why is that working?
I think the credit goes to the culture of the organization itself. We have a very progressive thinking leadership team led by our CEO, Marcy Doderer, and our COO, Chanda Chacon, who believe that innovation and technology can be used to move us forward as an organization. A lot of people don't think of Arkansas necessarily as a seat of innovation and progressive thinking, but I can tell you at Arkansas Children, it's not only nurtured, it's built into what we do. This year, for example, we actually wrote for the first time in our system goals an innovation goal around technology.
As a digital ethnographer, you're sitting and listening on these message boards, you and your team members, real human beings doing it.
Actual human beings, yeah.
What's the role of the active talker versus the lurker?
That's a very important distinction. So before I even sat down for the interview, I might look at Facebook and I might be a participant in some discussions, things I feel like I need to comment on. There's others where maybe another cute baby photo where I may just hit like, I don't need to talk about it, I'm just going to endorse it. So I call that an endorser. But then there's also the lurkers where I may see something I completely agree with or don't agree with, but I'm not going to bother to engage with it right now. Or maybe better put, if there's something that's broken in my house, I might go to ilovewhirlpool.com to see if I can fix my dishwasher, but I don't need to join it, I don't need to ask the question. Point is, I might just be lurking to find the answer to something. And that's what we see, especially in healthcare, is we know that for every participant, there's about 100 other lurkers who have the exact same question. They don't need to ask it out loud, because it's already been asked, people are already answering it. And so it's really important to understand that influence on just what the community is providing to even those who aren't speaking.
This digital behavior, does it vary regionally? Does it vary by generation?
All of the above. It can be radically different based on geography, even county to county. And certainly in Arkansas's case, you could see it incredibly different just quarter of the state to the other side of the state. And it can be lots of factors are into that. It's not as if it's only different online, but it's the fact that you can actually see some of these differences that might show up in a quantitative study. You actually see them writ large and how they might prioritize things differently. They might act differently in a decision path towards a particular kind of service very differently. And that might be generation, or probably even better, life stage versus geography versus a number of other things that might play into that.
A generation versus life stage, well put with you as about to having your next generation of children, right?
That's right. Well, and that's exactly right. And that's the important thing to remember. And this is a soapbox I'm easy to get onto. But the oldest millennial is 38, and they may have kids in college. So it is so much better to focus on life stage rather than generation. And actually, what we do with ethnography, what we try to do is say, let's let the behavior tell us who they are, instead of coming to them with a sort of prescribed persona already based on generation.
Take me to a concrete moment. So you've done studies, you've got 8 studies you're working on with Arkansas Children's, some completed, some still in flight. Let's talk about an epiphany that you had that led to you changing the way you're doing something.
Sure. So one thing to understand, especially when you're talking about pediatric services, is that we're dealing with folks who, in most cases, have only really had one main contact with a hospital, and that's wherever their child was born. So in other words, they tend to be more low information or naive consumers. When they ask for an advice from other parents like them, they'll receive one story of their one contact with a hospital and whatever that issue or maybe potential birth was. So what that means is they never get a true comparison. It's always about consensus, just how many people all said, this particular hospital or this particular facility versus another. And so it's always interesting when we talk about pediatrics to kind of frame it there first. So in what we've done with Arkansas, we've been able to see within different markets, just even different shapes, different priorities between how they're choosing services.
And I think it's a great example where we have benefited and still benefit from a very strong brand presence in the state. It's a small state. We're the only pediatric health system in the state, a very long and rich history serving the patients and families in Arkansas. And I think it developed us to believe that we understood how they looked at us. And we executed a specific study in Market A and a specific study in Market B. And not only did we learn that we were a little bit inaccurate in the way we were believing they perceived us, we saw some very distinct differences in the two markets that have really resulted in how we're approaching those markets differently from a marketing, positioning, messaging, how we're going after them as an organization, really in how we speak to them.
Absolutely. So one good example is even when you have a market where there's a lot of newcomers, people moving into the area. Well, that gets tricky when you start talking about pediatrics, because often that means that they're bringing a child with them that wasn't born there. So we just talked about naive consumers and low information folks. Well, what happens when they're almost at zero information because their only experience with a hospital is a hospital that isn't there? It was in out of state. So they're bringing a whole different set of expectations with them. So even just how a newcomer approaches, whether we're talking about two different markets, what are the newcomers in one market like versus the other? When they ask a question, who answers? Is it the come here's or the been here's that end up answering them? Or is it other newcomers who were just a few months ahead of them or a few years ahead of them? That can totally shape behavior in a way that isn't easily picked up in a quantitative study. It doesn't always get brought up in a focus group. It's the kind of thing that you really have to look at how they're asking and answering one another, and you get a much better sense of what that community really looks like, and then insights into the demographics and the consumers themselves.
Based on this work, what have you concluded that the consumer most wants in a healthcare system?
It's fascinating. From a parent perspective, at least to speak on that, what we've seen is that parents thrive on communication. And what's interesting about that is when a marketer hears that, you might tend to want to go one way or another about that. They may think that it's purely about the communication of what our ER wait times are, or any number of things. But what we've seen is that there's this sort of nexus around communication that involves, I want to know what my pricing is going to be for the bill, and I want that bill to come quickly so I can figure out what I'm going to do with that bill and how quickly I can pay that bill. It could be about wanting the midwife that really has a great relationship with the OB. It could be about just wanting great communication insofar as, can I make my appointment without having to call anyone? Now, we tend to bundle all those and silo all those in different ways based on how we operate internally at different health systems and different facilities. But when it comes to how the consumer talks about it, they see it as just how they're communicated to. And it's just a very different way to sort of turn the prism and think about what their expectations really are. And it's not just about ticking boxes on a trait or a service features.
How have the insights about how the consumer wants to be communicated with, how have those insights changed the way you frame the consumer interaction?
I think probably one of the most impactful measures is that we have started to gain a better understanding of the buying process. I think there's a lot of misunderstanding that there's a catalyst and an immediate response. So we've introduced, for example, an acquisition funnel, or marketing funnel as you might call it, such that the learnings that we're gaining here, we're not just speaking to individuals when they're on our campus and experiencing the care that we're providing. We're speaking to them in the awareness stage or the consideration stage. Hopefully they'll convert. And one of the areas we're really looking to infuse more communications and really reach more channels is the retention stage. So I think more than anything, it's really pushed us into different stages of the buying cycle, and it's helped our organization understand this process a little bit better.
It's important to understand that in that same funnel is then there's that same pathway that the consumer is going through, whether we're deciding to recognize it or not on the facility and on the system side. So let's take a look at it from the standpoint of someone who has great reviews, a facility that has amazing reviews, they're glowing, and actually Arkansas Children has incredible reviews that really explain what attention to detail in the atmosphere is like being there. But in order to go see those reviews, first off, I have to know you already exist and that you're an option. For me to be seeking out you by name on Yelp, on Facebook, even just on Google and the reviews left there on your maps. So I have to know who you are. Well, to back up then, that means someone would have had to give me your recommendation. So you might really want to feel like you should almost rest on your laurels on how great that you might feel and look in the review. But understanding where it is in the decision pathway may mean that very few people ever actually see them. Or think about it from a service line standpoint. If maybe it's about childhood cancer, maybe it's about leukemia, for example, you may have to really search those reviews to find the family that also went through what you went through. So it's also understanding, what does this really look like from somebody who's making that decision? That's why it's so important to not just think about it from an on-site perspective, but what are all these other milestones on the pathway that this consumer is going through that isn't about, I saw your name on a billboard and I suddenly showed up. What's happening in between?
There's an amazing fragility in the healthcare relationship, and the relationship between that consumer and the health system, the consumer and the physician, can be shattered very quickly. Talk more about that.
I think one of the unique attributes of the pediatric healthcare market is the emotion level. We're all parents here. It's one thing when it's you needing care. It's another thing when it's your child. And we all know that when we get emotional, we don't think clearly. And we're looking for validation. We're looking for someone like me to talk to about what I may be going through. So I think one of the really key differences is it's a different buyer mentality when it comes to your child being sick.
I think to build on that is that we often hear the win the baby, win the mom. What we see though in the message boards is the opportunity or problem of win the baby, lose the mom, where the birth experience may have been fantastic, but then when it comes to actually providing care long term, that can end up being incredibly fragile. One of the things we saw in one of the studies, and it was a fantastic thing from an Arkansas Children's standpoint, is how many times when there was a direct comparison, that it was always about how I had this experience and I decided to switch and take my child to Arkansas Children's. But what's interesting about that is, as great as that is to think about and be happy about, it's also showing you they were willing to switch. And it may not have taken as much as you think for that decision point to actually turn.
We think historically that the primary care physician and patient relationship is the most powerful relationship in healthcare. Based on your work in digital ethnography, are you starting to wonder if it may have changed a little bit?
I think it's changed more than anyone wants to admit. And the problem is, it's not about the quote unquote expertise necessarily being what's leading that trust level. I think that what happens is you end up with a trust level that is actually between a peer group, and the physician is just seen as just outside of that bubble. They can love their physician, they may trust every referral that originally comes from them, but it is also amazing to see how they will turn on a dime on things you may not have necessarily thought they would have, and go back to that peer group and say, thank you for the initial recommendation, tried them out, had a decent experience, but I've decided to do something else. So give me another round of recommendations. And they go through the process all over again. So while that trust level absolutely is key, and that loyalty can be won, it can be incredibly fragile, and that peer group may matter more now.
Some people think that brand is the only reason why someone may choose your health system. And I would say aspects of quality, those are now the ante. You have to have those to get in the game. And one of the interesting things we've learned from these studies and from other studies that we've conducted is that millennials are willing to trade location for convenience. Meaning, if we can make it easier for them to interact, engage, experience, and help them manage the health care for their child, they might be willing to bypass the health system that they have used or is right there in their neighborhood, simply because we've designed a system that meets their process needs as much as their outcome needs from a healthcare standpoint.
You know, often we mistake everything into some more cold terms about sort of more transactional terms about what people want. And actually, I think it has a little bit more to do with how empathy can actually express itself in far more than just messaging. There's empathy in design, in making a new building that has features that convey to the parent that's there that you understand exactly what they're going through and help turn parts of their experience into not just exceptional, but truly empathetic and understanding. And we've seen that. We see that in the behavior of how they express themselves. And I think what happens is it lets you understand and think about the communications angle, that when they say they want to make appointments easier, that you helping them to do that is not purely just making a transaction faster, it's that you understand they have a busy day and that it's important. They may not get around to sitting on their bed with their iPad out till they've gotten the third kid to bed and they can finally make their appointment. They're not thinking about that in pure cold terms. They're thinking about that as they have thought about what my life is like. And it's an empathy that comes through in far more than just messaging then.
I can tell you from the standpoint of our organizations, we've had a lot of conversations about how we need to own more of that experience and that support to families. We have a lot of clinics that end at 5 o'clock, but healthcare for a family, for a young family, is 24/7, 365. How do we support them from 5 o'clock until 6:30, 7 o'clock the next morning when healthcare starts back up for everybody? And I think that technology is enabling us to do that with things like online scheduling, appointment request forms, live chat with physicians, the ability to sit down at 10:30 at night when they have 5 free minutes in their day to go and research the physicians and read reviews and say, this is who we're going to see next week. I would like to get to know this person. And that's about us being smart about putting the information out there so when they're ready to go get it, they can come to us and it's sitting there.
I've really enjoyed the conversation. Dean Browell, Jeff House, thank you so much for joining the Business of Healthcare today.
Thanks for having us.
Watch, listen, or read Business of Healthcare interviews at bohseries.com.